When I speak to patients about minimally invasive spine surgery, I explain that most surgeries fall into one of three categories. The first category is decompression surgery. With decompression surgery, we're making small incisions, maybe using an endoscope or a slightly smaller tubular retractor to go down and remove tissue that's pressing on the spinal cord or nerve roots. This may be bone, bone spurs, ligaments, disc fragments, or cysts. Another type of surgery that we do is called disc replacement surgery or arthroplasty surgery. With these surgeries, we also make small incisions. We go down, we remove a disc, and we replace it with a device that maintains natural movement within that joint. A third type of surgery that we do is called spinal fusion surgery. With spinal fusion surgery, we're trying to fix two or more bones together. To do this, we need to place, most of the time, some sort of instrumentation into the body. And that includes rods, screws, plates, sometimes cages into the disc space. We look at each patient and we look for the least invasive way to address their problem. In some cases, for example, a patient that has a very severe spinal deformity, there are limitations to what we can do with minimally invasive surgery. So in those cases, we do have to do traditional open surgery. I think it's very helpful to see a couple of cases and get a better sense of what minimally invasive surgery is all about. In this first case, this patient has leg pain and weakness associated with a lumbar radiculopathy. Radiculopathy refers to an irritated nerve which has been pinched by a herniated disc. When this patient's symptoms failed to improve with non-surgical therapy, we performed an outpatient endoscopic discectomy procedure. Here we are using the endoscopic camera and tiny instruments to relieve the nerve compression. The patient had immediate pain relief and discharged shortly after his procedure. In another case, we used a slightly larger minimally invasive tubular retractor that separates the muscle fibers. No muscle cutting is needed. This patient is suffering from severe leg pain and inability to walk any distance. Her MRI scan showed severe spinal stenosis, or narrowing of the main spinal channel where the nerves run. We worked through a tubular retractor with a microscope and long instruments to remove the lamina bone and ligaments compressing the nerves. The patient experienced significant relief from this operation, and she discharged from the recovery room. Her postoperative MRI scan showed resolution of the stenosis. In this third case, a patient has intractable lower back pain related to arthritis and abnormal sliding between the lumbar 4 and 5 vertebrae. We recommended a lumbar spinal fusion procedure to eliminate the painful movement and nerve pinching. We used robotic technology to place the screws in the spine. Here we are cleaning out the disc space and placing the cage in the disc space. Final x-rays are shown here. The use of several small incisions and minimal soft tissue damage around the spine allowed for a rapid recovery. As a spine surgeon working at Mayo Clinic, it is incredibly gratifying and rewarding and exciting to offer patients the latest technologies and minimally invasive surgery techniques. Our goal for every patient is to get them better quickly, help them get back to life, and restore their quality of life.